Honestly, I think this will be gone. For one, I waited too long on having this surgery because it goes back to financial and no insurance and everything. I would have just sat on it more. It would have gotten a lot worse. But with Joe's recommendation and them visiting, the teams visiting me, yeah, it's turned around a lot.
Our community knows us best for putting out fires. That's what they expect us to do. But that's clearly not the only piece that we have to worry about in our community. People call us for all kinds of challenges. Our biggest part of our call volume is medical in nature. Nearly 70% of our calls are medical, and of those, there's a significant portion that are minor in nature. So people will call us because they have confusion around their medication or they don't have a medical home. And really, what we found was we were ill-equipped from the big red fire truck with a traditional firefighting crew to be able to handle those challenges. We didn't have the right tools in the toolbox or the training or frankly, the time to take care of those issues. So we created a mobile integrated healthcare unit with a nurse practitioner and 2 firefighter paramedics who could spend the time to solve those problems.
Some of these people that call 911 don't have access to healthcare. So essentially, we're that access to their healthcare.
Almost all of the people we see are in a gap where they don't have the funds. They maybe have enough funds to pay their rent and to feed themselves, but anything outside of that, whether it's medications or eyeglasses or seeing a physician for something they may consider minor, is just out of their range. And that's where we come in.
Joe and his partner, they kept on coming back to check on me, more blood work and withdrawals, trying to get my diabetes under control.
When he came to me, he was truly really sick. So we got him a glucose machine so he can check his blood sugar. We go into his home regularly to make sure he's following a routine because his blood sugars are out of control.
Like I said, it's been unbelievable since then. Joe's been here 5 times, maybe 6 times, and he does show a lot of concern.
Having the guys in the mobile unit go to the home and they get a relationship with these patients that need a lot of patient education, and they can do that education for them. They can, look up resources. They can be just amazing benefit to them. For the patients that might not understand their diagnosis or might not understand the medications, they are just like having a mobile doctor right there at their side.
Kind of reminds me of the old days, a doctor visiting a home. All you got to do is just make a phone call. They'll swing right by and check on you. I feel pretty privileged, special, lucky, definitely lucky on them being there for me.
Some people have asked us 3 or 4 times, what is this going to cost me when we see them? And our answer is nothing.
The real beauty of it is the relationships they're making in the healthcare community and everywhere else in our neighborhoods too. We spend a lot of time with the Olhe School District, working with them to take care of children who need a little extra care because of their medical condition or because of some family circumstance where they need a little extra help, making sure they get the medical care they need.
So what we've created with a partnership in the schools is the nurses will contact us for maybe not the emergency response, but something in between where Joe can come in, assess them, write them a prescription.
Parents have got to love this thing because the kids can get looked at, they can get prescribed medicines or whatever they need, and then we've already talked to the parent to get permission and that stuff. Then we just call back parents and say, hey, here's the deal. And they're like, sweet. I didn't have to come get them, didn't have to make a doctor's appointment, do all this type of stuff. So I mean, it's just a win-win. It's a win for me. I know I got good backup. It's a win for the kids. They're getting better assessment, immediate care, that type of stuff. And then again, for the parents, it's just a much easier situation. And it keeps the kid in school.
We found, a significant number of our repeat callers are in independent living facilities with older folks. And those things are typically associated with falls. So in order for us to reach out, we've created relationships with all the managers and a lot of the residents at the independent living facilities that might be eating breakfast there or giving a lecture about fall prevention. And then we'll also talk about medications. And that's where having a nurse practitioner really helps out.
It really is a win-win. It's a win for the fire department because now we have a resource and a tool that's specifically designed to handle those type of incidents. It's certainly a win for the individuals we're taking care of. Many times 911 is their last resort. They have no idea who else to call. And so they're expecting us to have some solutions for them. And we are very robust in our follow-up, making sure that the care continuum is complete. We don't just meet with them for 15 minutes and give them some ideas. We're there every day until they really find a true home in the medical community where they can be seen on a regular basis.
Nothing more than I can say, thank you. I wasn't able to walk on this knee for 4 months, and now you see me and I am walking, limp. That's better than an amputation or not walking on it at all.
So many times in emergency services, you respond to the emergency and we deal with it quickly, but we never really get to see if it's resolved or not because it's a 5-minute operation. We deal with the crisis, do our best to solve it and move on. And in this role, we really get to know people and get to know what their crisis is and help them have a long-term solution to it. So it's very rewarding.